Hello, this is Douglas Hamadishe, and welcome to the Automating Healthcare Administration through AI webinar, supported by Servelec, EBO, and Centric Health Media.
Very inspiring to see, the vision that EBO has, and this is why EBO is such a trusted partner of Microsoft, because I think a lot of what we see with the thousands of customers that we work with around the world is very much aligned with EBO's mission and vision. They empower the caregivers. They empower the administrative people, the patients. They empower them to really have the information more accessible, to have the information more visual. You know, it's known that 84% of healthcare executives believe that AI will actually revolutionize the way we obtain information.
Working with the team at EBO and East London and Somerset as well, we've built into the solution from the outset that kind of privacy aspects. So, ensuring that all information is, secured, encrypted. And we've adopted similar kind of processes to what you see in other applications like online banking and online shopping of, patient choice and two-factor authentication. So we've got a good, robust solution in place, which, people are familiar with. As Shona said, people are used to using digital solutions for managing their busy lives.
I think where we've really found the stress is on the admin. Because people are not able to just drop into the service and ask a question. Maybe they're out shopping, they've got a bit of time and they'll pop in and speak to a receptionist. A lot of our service users are actually calling. And that means that the phone lines are busy continuously. Our admins will miss some of the calls because obviously they're on the phone to another service user at the time. And it means that service users sometimes are trying to get in contact or another time that they find the time to get contact isn't until the late evening and the service is closed, as I was saying. So, it's really opened up our eyes to see that there are other ways that our clients can communicate with us. And there's other ways that we can communicate with the clients to make sure that actually it works for them.
Anything that we can implement and enhance, any current systems that we can enhance and bring in an AI system, it's magic.
We provide services to the community, to service users, patients, etc. But there's also, we have to take care of staff. And over to Lee's point about the health and well-being of our staff. Our staff are fatigued and they're bogged down by doing laborious, antiquated processes. There's a big problem that we have in health in terms of staff retention. If we don't have the staff, if staff are leaving in the droves, we cannot provide the care to people. So introducing AI technology will go a long way to improving the health and well-being of staff as well.
Now, the key goal here, this is one of the key goals that EBO is trying to do, is trying to ensure that the conversation is a natural conversation. And that is something that we constantly work on with all our virtual agents. The virtual agent answers frequently asked questions. It dynamically links to the Rio database and provides a link to the back office. I'm also going to show the opt-in option that will be available. The first time that a patient comes on the website, he may well ask a question such as, when is my next appointment? At that point, we need to identify the patient. Now, there are two routes to this. There's a route whereby you would use the NHS number, and we're trying to support the trust in the use of the NHS number. However, there's also a route using surname, postcode, and date of birth.
Oh, thank you very much for that. There are two things that popped out for me, and I'm thinking about what would trust be thinking about when it comes to this technology. One of those questions is auditability. How much information are you able to audit in terms of all the information flows on the app?
This is key. This is key from an audit point of view and from a confidence point of view. So each conversation is fully auditable, and it's all provided to the back office. So that you can identify exactly where the virtual agent took over. Everything is time-stamped, and the exact conversation is replicated in the back end. And the appropriate agents would have access to all that information. And so, yes, everything is
excellent. Excellent. And also, brilliant. And also in terms of the training, just how easy is this to train? And do you train the training to get this up and running?
Douglas, it's very easy. This was vital for this kind of solution to work. So there are two elements. Number one, I mentioned the natural conversation and us making sure that people who actually access the virtual agent will want to come back. That is twofold. The conversation has to be natural and easy to extract the information. And then there is the back office element that we would have to train people in as well. And that takes a couple of hours.
Just a couple hours,
100% honest, Douglas, within a few weeks, they are telling us how to use it. That is how it was, and exactly how to improve it and how to move on. And that is very much how we work these solutions.
Well, we tend to see that patient portals tend to be rigid. They are form-based, but we live in a culture which is more free-flowing, which is more conversational. I think hospitals need to get closer to the culture which we see in society. And ultimately, that is what inclusivity is about, Doug, right? It's making sure that we use the tools which are adopted by society. Secondly, patient portals, as the name implies, are for patients only. But the solution which we built together with Servelec provides a solution both for patients and for staff. Thirdly, patient portals are, by nature, a single channel. In other words, they're only exposed on the website. I think those days are gone, Doug. In 2021 and going forward, we live in the omni-channel world. So our virtual assistant is often indeed surfaced on the Trust's website, but is equally accessible via WhatsApp, via Facebook Messenger, via Microsoft Teams, in which it is pre-integrated, Skype, and other solutions. In other words, there are multiple routes to get to the core data in a secured and private fashion.
Sure. Just another quick question. Do you think the partnership approach enables you to scale solutions quicker across the NHS? We're seeing the need for solutions to be brought at pace due to the pandemic. Would you say that's supported by this philosophy, this approach?
Absolutely. Look, I mean, JJ and the team, we've been working with them for many years in various countries, right? And we have a team who work with NHS. But there's nothing like a scale that the partner brings, that they are, sitting with NHS day in, day out and really implementing these projects. And I'm hearing the feedback here. So, I mean, it's kind of like there are force multipliers. So absolutely.
Where are you seeing AI really adding its biggest impact into health?
Yeah, just to build on what Shona's just said, I think the key thing she said is carrying everybody with us. Carrying our patients, carrying our staff. And if companies can do that, then they will do very well, because the NHS wants to become more patient, customer, consumer focused. It wants to become more agile.
AI shouldn't be about, fancy digital transformation, lofty ideas. It should be about today's needs. It should be about the business value which we could bring in the next 3 months, right? And we see a huge opportunity in the back office challenge around appointment management. And this is something which we can solve now, right? So AI is really about real-time communication. If 100 appointments are cancelled now, we want the patients to know now, and we want 100 conversations to start now about rebooking them, right? If we have a gap which has become available now, we want a smart clinic management solution through AI, which can fill that gap so as to optimize the delivery of care. Often we fear AI incorrectly, right? AI is here to augment and not replace human agency, right? The idea of augmentation in the context of today means that there are so many repetitive processes that are costly and slow within a trust, and they are linear, and there is no reason for them to burn out human energy, right? AI can handle this without human intervention, whilst allowing our human staff to focus on what really matters. And often that's saving lives.